Good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Committee's situation report for Wednesday, June the 16th. The SARS-CoV-2 or the COVID-19 virus has been reintroduced into the Federation. It's circulating, and at present we are trying our very best to contain the current wave of COVID-19 cases. This wave was recognized on May 19th of this year, so that's about 4 weeks ago. And between then to present, we have added 206 cases to our COVID-19 tally. But let me just break this down. So for today, Wednesday, June the 16th, we have received results for 7 cases. Can I have the slide? Yes, for today, June the 16th, we have received results for 7 cases. So we've received positive results for 7 cases. Yesterday, Tuesday, June 15th, we received results for 18 cases. On Monday, we received 17 positive results. On Sunday, we received 9 positive results. Last Saturday, we received 13 positive results. So if you look on the slide, on the graph on the right, you see the actual number of cases returning positive results per day over this past week. And so you realize there was a peak last Friday, the 11th of June. And so let me repeat. We've added 206 cases to our tally over this past 4 weeks. I just broke down the number of cases we've added per day over the past week. To date, so at present, we have 186 active cases. 186 active cases. We've had 20 recoveries during this time period. 20 persons have fully recovered over this time period. And also, during this time period, we've had a total of 13 hospitalizations. 7 individuals have since been discharged, stable. And so at present, we have 6 cases in hospital. 1 in particular is experiencing moderate COVID-19 disease. And so the cadre of case managers monitoring these 186 active cases. They are monitoring them closely, and we are trying our best to have all of them recover as has been our experience so far. Now this slide provides us a summary of the status on the ground. So this is the total number of cases broken down. So the Federation thus far records 251 cases, 236 sent kits, 15 recorded nevis. To date, meaning between last March to present, 65 cases have fully recovered, and as I said before, 186 active cases in isolation, and they are being monitored closely by the team of case managers. As I said before, there are 6 persons presently in hospital. All right, so this slide is this slide is quite new. We just developed this tile or slide. We want you to get accustomed to it, because this would be our daily bulletin. At 6 p.m. every evening, we hope to update this slide and disseminate to the public, providing you timely updates regarding the COVID-19 situation on the ground. And so you see in the left-hand column, total number of confirmed cases within the last 24 hours, 7. So today, we've received results for 7, positive results for 7 cases. So that would be the first row, first column. And then on the right-hand side, you see the total number of cases, 251. So that's the cumulative total. And then you will be told the number of active cases, 186, the number of cases recovered, 65, and then we'll have the breakdown across the Federation, 236 cases on the tally for St. Kitts and 15 cases on the tally for Nevis. And then we have the number of negative results and deaths and the world figures down the bottom. And so, ladies and gentlemen, this would be the tile that would be submitted, disseminated at 6 p.m. every day, updating you on the COVID-19 situation on the ground. Okay, so what's the way forward? So what we are doing is utilizing the public health measures or tools to help us to flatten this curve as we did last year. And so we are using contact tracing, we are testing, we are continuing our COVID-19 vaccination rollout, and then the restriction you just heard about. So these are the public health interventions, the public health tools that we are utilizing to contain this outbreak. Our contact tracing process has been successful to date because most of the recent cases that we've identified, we have done so through the contact tracing process. And because we have picked up these cases as soon as we have actually prevented a significant number of cases by just contact tracing alone. So to date, the team we have interviewed, we have engaged 1,887 persons. We've officially released 1,238 persons from quarantine, and so we have 649 individuals remaining. And so our contact tracing process continues. Testing, that's another tool that we are utilizing. So we are testing our cases, we are testing their contacts, and we are also conducting targeted testing in communities in order to prevent clusters in different geographical areas. And so we will continue doing so. Within this last 4-week period, we have tested over 5,633 persons. In essence, we have tested about 11.9% of the total population within this short space of time. And so this is good, and we will continue. We continue our COVID-19 vaccination rollout. And so, again, we started our vaccination program in February, so it's almost 4 months. And within this short space of time, we have attained these the following coverage rates. So 66.3% of the target population have been covered with the first dose of the AstraZeneca Oxford vaccine, and 31% of the target population is covered by the second dose or fully vaccinated. So in essence, 10,255 nationals or persons in the Federation are now fully vaccinated. And so when you compare St. Kitts and Nevis with the neighboring islands that make up the Eastern Caribbean Currency Union, we are doing quite well in terms of our COVID-19 vaccination rollout. And so we will continue, because the more persons we have vaccinated, the greater the proportion of individuals who who would have had acquired immunity, and this in and of itself would help to break the chains of transmission of the virus as we speak. So this is very, very important. I also want to utilize this opportunity to remind our breastfeeding and lactating women that you are able to come on board and accept this vaccine. The scientific information tells us that it is safe for breastfeeding women to take this vaccine. Let me just underscore, it is safe for breastfeeding, lactating women to take this vaccine. So very, very important. I also want to remind those who have already gotten their first dose. We want you to look at your card, note your appointment, and if more than 4 weeks or 5 weeks has elapsed between your first dose and present, you can indeed come in earlier than the date on your card and get the second dose of your vaccine. We are actually encouraging that. So we are encouraging persons who have gotten their first dose, you can come in to the nearest health center and get your second dose even before the appointment that is indicated on your vaccine card. Once at least a month, that's 4 to 5 weeks, has elapsed between your first dose and present. So this is very, very important. Now, in terms of the restrictions, the strict restrictions that have been announced, the principle behind this public health intervention, yes. So restrictions or restricting the movement of individuals is actually a public health intervention that is employed during an outbreak. Or it's a public health intervention that can be employed during an outbreak. The principle behind this intervention is that it reduces social interaction and it breaks the chains of transmission of the virus. And we are hoping and we expect that with this measure, we will be able to reduce significantly, reduce the number of positive cases that we are seeing. But I want us to note that the effectiveness of this measure also depends on our adherence to the non-pharmaceutical measures during the period of lockdown. And so even though your movements, is restricted, we want you to still remember the importance of wearing your face mask, sanitizing your hands, and maintaining that distance in your own social network. So this is a very important point that I wanted to highlight this afternoon. Those of us who are virus-free, those of us who have not been diagnosed with COVID-19 to date, I want us to do all we can to prevent exposure to the virus. We need to protect ourselves from this virus that is in circulation. How can you do so? Well, one, by accepting the vaccine. So if you're not vaccinated, if you've not yet come on board in terms of accepting the vaccine, we want you to do so. And then we want you to wear your face mask at all times. So now I'm very comfortable in wearing my face mask. Once I step through my front door, it's on until I get back home. So you need to wear your face mask at all times. Maintain hand hygiene. So I have hand sanitizer. I have soap and water in my car to wash my hands. Yeah? The ladies at work laughed at me, but that's how serious I am in terms of maintaining hand hygiene. Physical distance. Some persons, may think you whatever, but you need to maintain that distance whenever you're in the public spaces. For example, if you're going to the supermarket or the pharmacy, you need to maintain that physical distance. And it's only, so right now, over this 2-week period, we are supposed to be sheltering in place. You only leave home if it's an essential errand or task that you are going to complete. If you have been diagnosed with COVID-19, we want you to do your part and not pass on or spread the virus to your loved ones, to your family members, or to anyone for that matter. So if you have been diagnosed with COVID-19, so if you are one of our active cases, we want you to do all you can and not pass on or spread the virus to anyone, okay? We also want you to boost your own immune system. We also want you to recover speedily. And so we would implore that you eat healthily. So that's fruits and vegetables, smoothies, you know, made from, you know, the same fruits and vegetables. Maintain adequate hydration. Make sure you drink enough water. Of course, you must rest. And then there is exercise. You can do push-ups or abdominals, whatever you like. So exercise is still very important, even while in isolation or self-isolation. And then, of course, you have your multivitamins and supplements. So these are some of the things we want you to do in terms of those of you who are, you know, recovering from COVID-19. I want to speak to the contacts of the COVID-19 cases. So if you have had contact with someone, a loved one, a co-worker who is now diagnosed with COVID-19, we want you to stay at home. Yes, stay at home. So if you are a contact of a recently diagnosed COVID-19 case, if it's your coworker, if it's a loved one, and you have had significant contact with that individual, we are asking you to remain at home and to self-quarantine for 14 days after your last contact with that individual who is now diagnosed with COVID. So that's your self-quarantine period, 14 days after your last exposure to the individual. And then during this period, and especially or particularly at the end of your self-quarantine period, you must be tested. So that 14 days post-exposure test is critical. If that test returns negative, it means you are cleared and you can be officially released from self-quarantine. If you're not yet certain about your testing date, or if you've not yet received a test, you can call 311 and seek advice regarding testing. Now, if you are fully vaccinated and you have had contact with a known COVID-19 case, you also require a test. And so we recommend that you complete your COVID-19 test 7 days post-exposure to the COVID-19 individual, or the individual with COVID-19. Protect yourself against COVID-19 by following the well-known prevention and control measures. And most importantly, if you have not yet come on board regarding the vaccination, do not wait any longer. Vaccinate. Thank you.